are going to review with you one of our patients who underwent a full face Easy Gel. In general, we are doing full faces with the Easy Gel, especially in our patients who are 50 and older, because most of us are needing multiple areas for volume replacement and for collagen rejuvenation and for regeneration of our skin. So Mallory's going to kind of describe what we did on the patient over here.
So this is our patient who had Easy Gel a week ago. As you can see, she's absolutely stunning beforehand, but we wanted to kind of make her feel refreshed, lifted, and a little bit more youthful. You can see she's lost some volume underneath her eyes. She's also starting to get a little flattening in the front part of her cheek, which is a normal sign of aging. We're starting to see some more signs of a nasolabial fold, as well as some signs of aging right on the surface of her skin, just from some loss of the fat pads below the skin.
So what she underwent was how many vials of blood did we draw for her?
2.
2 vials of blood. 1 vial was converted into the albumin, which is the gel part, and we placed the filler in the under eye, we placed the filler in the nasolabial area, we placed it, softened the chin crease and the marionette area. And here is our beautiful patient 1 week later, looking nicely volumized. Mal, just kind of go over why she looks better.
So I think one of the most noticeable things right away is actually just the change in her skin. Within these natural fillers that we can make from your blood, they've got a bunch of growth factors in it, collagen stimulating growth factor amongst many others, and that just honestly makes the skin look brighter and more youthful, but also the volume increase that she's gotten. So as we age, we lose volume, and you can just tell that something happened, something very positive happened, but you can't put your finger on it because she has a natural amount of volume. Our eyes draw toward unnatural amounts of volume, but that is not this. She just looks more refreshed and youthful because everything is picked up.
Exactly. So the pickup is more on the lateral face, the mid face here, and that's more from reinflation from the volume loss and some rejuvenation as well. And this is 1 week after the procedure, and we will continue the post-recovery over the next few weeks to months. So her plan is to come back in 4 to 6 weeks for a second session. And how many sessions are we suggesting our patients undergo?
We're suggesting 3 sessions, 6 weeks apart. That is a great place to start. Does that mean everybody needs 3 sessions? It is a good idea, but some people may even opt for more. And then also 1 session a year to maintain the result.
Correct. So the protocol is 3 sessions the first time you have it done, and then for maintenance we're suggesting one session annually, and it's more of a regenerative treatment. We are placing fillers obtained from your blood. We treat it a certain way. We had a question on our social media, how is a gel made? Can you describe the gel making process?
Sure. So we draw 2 tubes of blood. One of the tubes of blood we spin down, we get the albumin out of it, and that is something that gets heated up, and through the heating and cooling process it turns into a gel-like consistency. The second vial of blood we turn into something called PRF, which stands for platelet-rich fibrin, and that is where those concentrated growth factors are. We mix those 2 substances together based off the area of the face they're going into and based off of essentially the consistency we're looking for from the filler, and that is what comprises the substance that we're injecting back into your face. It is 100% natural. There's absolutely nothing added. This is regenerative medicine, which is really exciting for the industry.
And in terms of where we can go with this, questions we get asked is, how is PRP different than PRF? PRF is a longer, slower release version of PRP. Is that a good way to describe it?
Yeah, that's a great way to describe it. I think we're finding ways to make sure that all those growth factors hang out in our body tissue longer, because the longer amount of time we're exposed to those growth factors, the more effective they are.
And the other fun things that we can do with the PRF and the Easy Gels, we can also mix it with fillers. So if you need something that's going to do this regenerative treatment, but also for longer term volume replacement, we can add fillers, right? Mm-hmm. And other things such as exosomes can be placed topically as well on the skin. It can be combined with lasers, the treatment, so we can really do a multi-layered approach for skin rejuvenation at this point.